Welcome to GAAF USA TV, the official YouTube channel of the Guardian Angels of America Foundation. Our featured beneficiary today is Zian Carl, a 3-year-old baby boy from Quezon City. He is suffering from Netherton syndrome, erythrodermic versus psoriasis, global developmental delay, chronic malnutrition, tuberculosis, pneumonia, and anemia. The goal of this channel is to find assistance for the sick and poor children in the Philippines who are crying out for help.
Zian is another COVID-19 baby born on October 19th, 2020 at Rosario Maclang Bautista General Hospital in Quezon City. This was the time when COVID-19 cases were at the highest rate of 40 million worldwide. Thus, all of hospitals were full of mostly COVID patients. Baby Zian underwent the routine newborn screening test and he passed. This means that he was found to have a normal oxygen level and is not at risk of congenital heart disease. There was no further testing needed, so the mother and baby were released home. However, 2 months later, baby Zian showed redness with fine scaling in the neck with some fluid leaking. Since hospitals were full of COVID patients, he was brought to a clinic for a checkup. He was prescribed mupirocin ointment and cetirizine syrup. It got better, but unfortunately it lasted only for 2 days. Then outbreaks of red and scaly rashes started to spread in multiple body parts. At 10 months old, his parents brought him to Nueva Ecija, where they were recommended to a good dermatologist. However, there was no improvement in Zian's condition. His skin would get better temporarily but would worsen again after a few days, along with an intermittent fever. At 1 year old, despite COVID-19 still on the rise, he was brought back to Rosario Maclang Bautista General Hospital for treatment, but the cycle continued. He would get better for a few days and get worse again. The skin redness had progressed to multiple skin infections and lesions spreading to his head. In May 2023, Zian suffered from pneumonia for the second time. He was also diagnosed with TB lymphadenitis. The medication prescribed made his condition even worse. He got an infection and his skin turned red with an abscess this time. In July 2023, he developed a tumor in both underarms, which had been reported to have a higher incidence in Netherton syndrome patients. It had to be surgically removed despite the worsening condition of Zian's skin. Luckily, the operation was successful. He had to stay in the hospital to recover for 3 to 4 months, but was cut off to 1.5 months to avoid getting infected by other severe cases in the hospital. Zian is a very courageous little boy. At a young age, he does not deserve all the excruciating pain he is experiencing, but he is bravely facing all the painful tests and clinical trials being done to cure his rare skin disorder. In search for a better cure, Zian has been brought to different hospitals such as the Philippine Children's Medical Center in Quezon City, Good Samaritan in Gapan, Nueva Ecija, and back again at Rosario Maclang Bautista General Hospital. At present time, he is being treated at East Avenue Medical Center in Quezon City. Genetic testing was recommended for Zian to confirm the disease. If done in India, it will cost 20,000 pesos, while if in the USA, it will approximately cost 100,000 pesos to 100,000 pesos. The family is appealing for financial help to cover the cost of genetic testing and all the prescribed oral and topical antibiotics medications, special lotion, and other medical supplies recommended for baby Zian.
Erythrodermic psoriasis is the initial diagnosis Zian was thought to have, and it is a rare type of psoriasis that affects about 2% of the population. This condition disrupts the body's normal temperature and fluid balance. This may lead to shivering episodes and swelling in different parts of the body. Patients with this condition are also at a higher risk for infections, such as in Zian's case, he's had bouts of pneumonia, tuberculosis, and multiple skin infections. This condition affects nearly the entire body and can be life-threatening. It is usually treated by a dermatologist and is a very challenging condition to manage. The other diagnosis Zian is presumed to have is Netherton disease, which is also a very rare disorder affecting the skin, hair, and immune system. It is inherited in an autosomal recessive pattern, and the diagnosis is based on clinical exam, symptoms, and genetic testing. Thus, if Zian were able to get the genetic testing done, it would provide a long-awaited answer for him and his family. The symptoms are usually present in newborns and infants and can include red, scaly skin, fragile hair, itchy skin, allergies, asthma, developmental delay, and delayed growth. Unfortunately, there is no specific treatment for Netherton syndrome. The goals of treatment are to manage the symptoms and prevent infections and complications.
I would like to invite you to become an angel to Zian. You can be an individual, a group of friends, a corporation, or an organization. All donations are tax deductible. GAAF is a 501c3 tax-exempt organization. You can donate any amount you can afford. It'll definitely help Zian transform his life. Zian has 6 wishes. Number 1, high chair. To comfortably feed Zian, he needs a high chair instead of sitting on the floor while being fed. This will also enable him to join the family in the dining room during meals. Number 2, stroller. Due to skin tightening and joint contractures, baby Zian's mobility has been affected. Though he can sit, he could not completely extend his legs. Thus, he is not able to walk at all at 3 years old. He will be needing a stroller to help him get around for his checkups. Number 3, air cooler. Due to the delicate skin condition of Zian, an air cooler is essential to cool and humidify the surrounding areas where high temperatures and low humidity can cause discomfort and more aggressive skin irritation and infection for Zian. Number 4, wooden crib. Zian needs a new wooden crib as his old one, which has been hand-me-down from someone else, is already breaking down. Number 5, psychological counseling. Dealing with a rare disease like Netherton syndrome and erythrodermic psoriasis, Zian, including members of the family, will be subject to bullying. The family is advised to undergo psychological counseling to help improve their well-being, reduce and manage stress, and improve overall functioning in their lives. Number 6, monetary assistance. Zian's mother is asking for monetary assistance for the genetic testing and for the medication expenses such as special lotions, oral and topical antibiotics, emollients, eye lubricants, other medical supplies, and also nutritious food. He will also be needing money to sustain regular skin swabs to monitor infections and other manifestations of Netherton syndrome. It would be a big help for GAAF USA TV if you can click the like, share, and subscribe buttons, including the notification bell, so you don't miss any of our future videos. Thank you for your support.